Good morning, everybody. This is Nurse Eunice with Florida Training Academy. And in today's video, we're going to be covering medical terminology. That's right. We have a fast-paced practice test. And just give us a few moments, about 10 seconds, and we'll be getting started shortly. So let's see who's already here. Good morning, Vanette, Maria, Betty, MFW. Looks like we have Rylas, Chrissy, and everybody else as you're coming in. Good morning. We'll get started in 10 seconds. So tomorrow, Saturday at 10 a.m., if you're interested in learning about EKGs and you want to do a EKG rhythm test, you have to go over to my other channel because I listened to you and you told me that you wanted this channel to be for CNA and CPR and my second channel to be more for that NCLEX prep for the nursing students. So it's, youtube.com/Eunice Mathis is on the top of your screen. Tomorrow at 10 a.m., please go over to my second channel so that you can learn about EKGs. In this video for medical terminology, we'll guide you through essential terms that are commonly reviewed in certification exams. And of course, the terms you're going to hear in the real world. Our goal is to help you confidently understand and apply these key terms so you're prepared to answer related exam questions and also speak with other medical professionals and your patient with ease and accuracy. And so before we get started, if you haven't already done so, thank you for your support. We're going to ask that if you enjoy this video, that you like it, that you share it. As we're going through and reviewing the questions, we're going to ask that you comment. And if you haven't done so, let's make it official and let's subscribe to the channel. All right, so question number one, we're starting off pretty easy. Question number one, which prefix means slow? Is it A, tacky, B, Brady, C, hyper, or D, hypo? Please put your answers in the comment box. Hello, Serafina from Kenya. Oh, Nick Bell, that's right. Chrissy, Buck, good morning, everybody. Michelle, oh, that one's so easy. You all know that slow or Brady stands for slow, as in bradycardia or a slow heart rate. Question number two, the suffix ectomy refers to, is it A, disease, B, repair, C, inflammation, or D, surgical removal? What does ectomy refer to? Looks like I'm not sure if Layla, if that's from the first one or the second one. So Michelle says D, LT says D, Nick Bell, Buck, Anna K, Macinda, Chrissy. So let's see if you're right, everybody. Surgical removal is the correct response. So the answer is D. Ectomy refers to the surgical removal of a part of a body, such as appendectomy or the removal of the appendix. Question three, the root word cardi or cardio relates to, is it A, lungs, B, heart, C, blood vessels, or D, brain? And because this is a fast-paced review, we'll be revealing the answers in 3, 2, and everybody got it right. It is B. Cardi or cardio refers to the heart, as in cardiology. Question 4, what does the prefix hyper mean? Is it A, below, B, slow, C, above or excessive, or D, fast? And I'm so proud of you all. And I hope that if any of you were impacted by hurricanes Helene or Milton, that you're on your way to recovery. And so if you chose C, above or excessive, you're absolutely correct. So hyper refers to something being above normal or excessive, such as hypertension, which also means high blood pressure. All right, question 5. What does the suffix itis means or indicates? Does it indicate A, tumor, B, inflammation, C, disease, or D, condition? The suffix itis. So a prefix comes before a word, a suffix comes at the end of a word, and it helps to create our medical terminology. So if you chose B, inflammation, You're absolutely correct. Itis refers to inflammation such as arthritis or the inflammation of joints. Told you you're moving fast today. Question 6. The abbreviation BID refers to, is it A, twice a day, B, once a day, C, 3 times a day, or D, as needed? Let's see what we put in the responses. I hope you all are so proud of yourself because I think like all of you all have gotten the first 5 questions correct. And so revealing the answer in 3, 2, and yes, BID is short for biz and die. Remember, our medical terms are from the Latin origin, and that means twice a day. Question number 7. The root word nephro refers to which organ? Is it A, liver, B, kidney, C, stomach, or D, heart? Let's see. I think I see A's, I see B's. We'll reveal the answer in 3, 2, and when you think of nephro, like nephrology, that is referring to the kidney. So the correct response would be B as in boy. Whenever you have neph in front of a word, that means it relates to the kidney. The prefix tachy means, is it A, slow, B, fast, C, large, or D, small? When we say a person has tachycardia or tachypnea, what are we referring to? Chrissy, Anna K, Neo Us. One day you're going to let me know how to pronounce your name. LT, Layla, Buck, Macinda, Nick Bell, Sarafina. You all are absolutely correct. You know that tachy means fast, as in tachycardia or a fast heart rate. Question number 9. What does the root word hepat or hepato refer to? Is it A, liver, B, stomach, C, lungs, or D, pancreas? And I thank you all for joining me on this early Friday morning review. Tomorrow at 10 a.m. on my other channel, we're going to have a review for EKG. So I hope you all will join us there. And I'm going to reveal the answer in 3, 2, and yes, everybody, it is liver. So the correct response is A, hepata or hepato refers to the liver, as in hepatitis, which is the inflammation of the liver. I told you all, I started late. I haven't had coffee, so forgive me. So question 10, the suffix algia, as in neuralgia, means, is it A, inflammation, B, tumor, C, pain, or D, infection? Algia. I see some A's. I see a C. I see more C's. Let's see if we have any other responses. Macinda, Michelle, Chrissy, Nick Bell, Neoas, LT, Maria. Yes, it is C, pain. The suffix algia means pain. So neuralgia refers to nerve pain. Question number 11. This is an easy one. The abbreviation NPO stands for, is it A, food as needed, B, at night, C, after meals, or D, nothing by mouth? So proud of you all, team. I am so proud of you all. You are great healthcare workers, professionals. And if you're not already in the healthcare field, I'm welcoming you now, because if you chose D, you understand that NPO means nothing by mouth, and again, derived from the Latin culture, which means nil per os. But whenever you go into a patient's room, if their diet order is NPO, do not speak medical terms to your patients. You're going to go into your room and say, hello, Mrs. Mitchell. I am Susanna. I am your CNA today. And I see that your doctor has an order where you're going to be without food today until they get through with your test. That also means you can't have anything to eat or drink. So don't use the term NPO. Tell them what it means and then try to explain to them why, because they're going to want to know, why am I NPO? Well, because your doctor has said so, but I'll get your nurse in here to discuss it with you further. Question number 12. In the term gastroscopy, what does the suffix scopy mean? Is it A, cutting into, B, viewing or examining, C, inflammation, or D, infection? When you think of a scope, like a telescope, what do you do with a telescope? And if you chose you view, you are correct. So it is B. The suffix scopy refers to using a scope. It is a tube that has a camera on the end. It's an instrument to visually examine something, such as gastroscopy is the examination of the stomach. Question 13. Which term means the study of the skin? Is it integumentary? Is it ophthalmology? Is it dermatology or neurology? Which term means the study of the skin? And you all are so great. Very proud of you. Revealing the answer in 3, 2, and it is C, dermatology. Question 14. The prefix peri in the term pericardium refers to A, inside, B, around, C, below, or D, within. Peri, what does it stand for? Oh, you all, great job, great job. I see so many correct responses. I see A's, I see B's, I see C's. So for you all, peri stands for around. So the correct response is B. The prefix peri means around. So pericardium is the membrane that surrounds the heart. And so if that's a new term for you, make sure you write it down so that you won't get tricked again on one of our upcoming tests. All right, so Nurse Eunice needs coffee stat. Question 15. The abbreviation stat means, is it A, immediately, B, after meals, C, before bed, or D, twice a day? Revealing the answer in 3, 2, and yes, that means immediately. So when would you hear that term in the hospital? Whenever there is an emergency. So like a doctor will write an order for a medication to be given stat, or if the nurse needs assistance with something, we're going to say, hey, let me choose a name, Serafina, I need you to go get the crash cart stat. That means like right now, immediately. Question 16, the prefix poly means, is it A, one, B, many, C, none, or D, small? Poly. We'll be revealing the answer in 3, 2, and Panda Cookie, sorry, says B. Buck says B. Macinda says B. Michelle says B. And you all are correct. Poly means many, as in polyuria or excessive urination, which could be a sign of diabetic ketoacidosis. It could be a sign of overhydration. So whenever someone is urinating excessively, make sure you let your nurse know, because that is not normal. Question 17. What does the suffix lysis in the term hemolysis refer to? Is it A, formation, B, breaking down, C, repairing, or D, inflammation? Lysis. Revealing the answer in 3, 2, and everybody got this right. It is B, breaking down. So the suffix lysis means breaking down or destruction. So hemolysis refers to the destruction of red blood cells. All right, so question 18, the prefix endo means, is it inside, outside, between, or under? Endo, what is the correct answer? Is it A, B, C, or D? Looks like we have C's, we have A's. Hi, Karen. We have more A's, we have C's. So we're revealing the answer in 3, 2, and If you chose A, you are correct. So endo refers to something inside, as in endoscopy, the visualization inside of the body. Question 19. What does the root word oste or osteo refer to? Is it ligament, muscle, tendon, or bone? And Vivian, I'm so proud of you. I see you giving a lot of correct answers. Also, hello, Fatima. So this one, I see some C's, I see B, I see D, I see another D, I see another B. So we'll reveal the answer in 3, 2, and osteo refers to bone. So the correct response is D, as in osteoporosis or the weakening of bones. Question 20. What does the prefix iso in the term isotonic signify? Is it A, equal, B, increased, C, decreased, or D, same? So when we say that we have an isotonic solution, what does that indicate? Looks like Cynthia and Anaya say A. Let's see if we have any other responses. Our A says D, Tamika says D, Vivian says D, Karen says B, Buck says D, Chrissy says D. Revealing the answer in 3, 2, 1. So for a lot of you all, this is a new term. Iso refers to equal. Hetero means same. So A is the correct response. The prefix iso means equal, as in isotonic, which refers to a solution that has the same osmotic pressure as another solution, typically body fluids. So when would you hear this? When we're speaking of normal saline, the bags, the fluids that we hang, that has the equal concentration of sodium as what the body has. That's why they call it normal saline, but that is considered an isotonic solution. It is normal, it's equal. Question 21. The suffix plasty in the term rhinoplasty refers to, is it A, repair or reconstruction, B, removal, C, examination, or D, pain? And one day, YouTube StreamYard is going to improve to where I can like actually hear you all call out the answers. I love doing these lives, but I kind of miss hearing your voices. So hopefully one day we can all get on together. Maybe if we even have to do it via Zoom, I think that'd be super cool. And if you think that'd be cool too, give us a thumbs up. Maybe I should do that. If I sent you all a Zoom link, would you all actually participate and show up with your cameras on? Give me a thumbs up if you'd be willing to do that. If I can get 10 thumbs up, I will schedule a live review and you all can choose the topic via Zoom. All right, I don't have any thumbs up yet. Anna Kay says yes. Serafina says yes. That's 2. I just need 10. All right, I'm going to keep going. So the suffix plasty in the term rhinoplasty refers to, as I see 4, I'm still counting, is A, repair or reconstruction. We're up to 5, you all. The suffix plasty refers to the surgical repair or reconstruction. Rhinoplasty is the surgical reconstruction of the nose. We're up to 6. We're up to 7 with Buck. Question 22, Karen, is number 8. Question 22, in the term osteoporosis, the term osis means, is it A, inflammation, B, tumor, C, abnormal condition, or D, surgical repair? Osteoporosis, what does the osis mean? And we'll be revealing the answer in 3, 2, and we didn't get too many responses for this one, but we did get a couple of C's. Elmita makes 9. We just need 1 more thumbs up and we'll be scheduling that Zoom. All right, so if you chose C, abnormal condition, you are correct. The suffix osis refers to an abnormal condition or disease, as in osteoporosis is a condition characterized by the weakening of bones. All right, everybody. We have 10. LT makes 10. So you all have pretty much committed to, if I upload or send you all a Zoom link, that you all are going to appear and you're going to be live with me via Zoom, and we're going to do practice questions. So at the end of this video, we'll decide what the subject should be, and we'll decide when we'll be hosting that particular webinar or live event. So I'm so proud of you all, and I look forward to actually hearing your voices. So question 23, the root word hemat or hemato refers to, is it A, skin, B, bone, C, muscle, or D, blood? All right, revealing the answer in 3, 2, and hemato relates to blood. So the correct response is D. Hematology is the study of blood. Question 24, which abbreviation refers to 4 times a day? Is it QD, TID, QID, or BID? Hey, so this one, you're a little bit slower with answering. Let's see. I have D's, I have C's, I have a lot of C's. So we'll reveal the answer in 3, 2, and yes. So anytime you see Q, just think of quad, which means 4 or relates to 4. So the correct response is C. QID refers to 4 times a day. As far as in the healthcare field, maybe we need to walk someone QID, or if you're a nurse or a respiratory therapist, maybe you need to give a nebulizer QID or a medication QID. Question 25, the prefix contra means, is it A, against, B, within, C, beyond, or D, within? So I have within twice. Please excuse that mistake. So which would be the correct response? Contra. I see C's. Let's see. I now see some A's. And if you chose A, you are correct. Contra refers to against or opposite, as in contraindication. So giving someone an aspirin after stomach surgery would be a contraindication, because aspirin causes you to bleed. It thins the blood. So anytime you think of contra, think of some things that should not be going together, as in contraindicated. Question 26, in the term fibromyalgia, the prefix fibro refers to, is it A, muscle, B, joint, C, nerve, or D, fibrous tissue? I see D's, I see A's, I see more D's. And so for some of you, this is also a new prefix. So the prefix fibro refers to fibrous tissue. Fibromyalgia is a condition characterized by widespread pain in muscles and fibrous tissues. So the correct response would be D. Question 27. The suffix megaly in the term hepatomegaly means, is it A, decrease in size, B, inflammation, C, enlargement, or D, hardening? Chrissy, Michelle, Anna K, Nick Bell, Layla. Let's see if we have any else. Panda, Serafina, Maria, all chose C, and that is the correct response. So enlargement is the correct answer. The suffix megaly, think mega, means enlargement. So hepatomegaly refers to an enlarged liver. Question 28, the prefix inter means, is it A, between, is it B, inside, is it C, beyond, or is it D, under? enter. And I think because we're on so many platforms, some answers are coming in a little bit later than others. And so if I don't call your name, it's not intentional. It's just that because of a delay between the platforms, I don't see your answers until we're on the subsequent question. So if you're not with us on YouTube, I would recommend that for our next videos that you go ahead and go to YouTube. You can go to youtube.com/Florida training or youtube.com/Eunice Mathis. I think if you're on Facebook, those are the viewers who are experiencing a delay. So the prefix inter means between. So it is A. Inter means between, as in intercoastal or between the ribs. I saw a lot of correct responses. Question 29. What does CVA stand for? Is it coronary vascular accident, cerebral vascular accident, cerebral vascular aneurysm, or coronary vein aneurysm? CVA. I see A's, I see C's, I see B's. Oh, I see a lot of B's. I see another A. Revealing the answer in 3, 2, and CVA is B. It is cerebral vascular accident. That also refers to a stroke. So what you'll usually hear us say is the patient had a stroke, but what happens is there was a lack of blood flow to the brain, aka CVA, cerebral vascular accident. Question 30. The prefix ecto means, is it outside, inside, under, or around? What does ecto mean? And we're going all the way to 50 questions. So I hope that you can stay around for the full video, but if not, just feel free to follow us on YouTube or on our Facebook page so you can go back and watch the rebroadcast. And so ecto refers to outside. The response is A. Ecto refers to something outside, as in ectopic, which is outside the normal position. When would you hear this? Ectopic pregnancy, when the mom gets pregnant, but the baby isn't in the correct spot. That would be an ectopic pregnancy. If the pregnancy occurs in a fallopian tube, that would be an ectopic pregnancy. Question 31. The prefix heme in hemiplegia refers to, is it A, one arm, B, whole, C, two legs, or D, half? Heme in hemiplegia. Looks like Masumet says D. Nick Bell says D. Panda and Chrissy says D. Anna K and Buck say D. So looks like Buck says A, so I'm not sure if something changed. Michelle says A. Sandra says D. Maria says D. Revealing the answer in 3, 2, and 1. The answer is D, half. So the prefix hemi refers to half, as in hemiplegia refers to paralysis or weakness on one side of the body. And so if someone has a stroke, it's actually opposite. So if the stroke happens on the right, that means that the left side of their body would be affected. And the reverse is also true, which is why in this image, so it looks like there had been a stroke in the right side, which is the color blue. And so the left side of the body was impacted by that. So this person, if they were in your facility, they would have a diagnosis of hemiplegia. Question 32. Which abbreviation stands for as soon as possible? Is it A, ASAP? Is it B, QOD? Is it C, NPO? Or is it D, BID? And I see now you all are putting your numbers with the answers. So I thank you all for doing that extra work. Vivian and Chippo, I see you. Layla says A. Buck says A. Chrissy says A. Serafina says A. And you are correct. ASAP stands for as soon as possible, which differs from STAT. So STAT is the priority. ASAP is all right. As soon as you get opportunity, you can't wait your entire shift, but as soon as you get opportunity, we need for you to go to the lab and go collect the tube or something. So ASAP versus STAT. STAT is more of a priority. The suffix ostomy, the suffix stomy, I apologize, refers to, is it A, paralysis, B, surgical removal, C, inflammation, or D, creation of an opening? When you see STOMY as a suffix at the end of a word, what does it stand for? I see some B's, I see a D, I see a lot of D's. And we'll give you about 5 seconds. 4, 3, 2, and yes, if you selected D, you are correct. It is the creation of an opening. So the STOMY refers to the creation of an artificial opening, as in colostomy, or here the image would be tracheostomy. So when someone has a tracheostomy, they have an artificial opening that goes right into the trachea, and that is how that will be their new airway. It's going to help them breathe. Question 34. The prefix auto means, is it A, other, B, same, C, self, or D, below? Auto, as in autoimmune. What does auto mean? I'm seeing correct responses. I see Chrissy. I see, looks like it's Rylas. I think I missed one. Karen, Island Queen, Miss Kenny. So if you chose C, you are correct. So self, auto means self, as an autoimmune. So a self-immune response. Your body is fighting against itself. Question 35. Which term means inflammation of the stomach? Is it A, hepatitis, B, gastritis, C, colitis, or D, nephritis? Inflammation of the stomach. Buck and LT and Anna K and Karen and Panda and Ann and Alan Queen and Nick Bell and Sandra. You are correct. It is B, gastritis. Gastritis means inflammation of the stomach. Question 36. The root word my or myo refers to, is it A, muscle, B, bone, C, nerve, or D, blood? What does myo stand for? All right, we're revealing the word. We're revealing the response in 3, 2, and if you chose A, myo refers to muscle, as in myopathy, and that's a disease of the muscles. Question 37. The abbreviation TID means, is it A, twice a day, B, 3 times a day, C, 4 times a day, or D, at bedtime? And I hope you're keeping score because I see a lot of you all are close to making like 100% on this medical terminology review. So, question 37, the correct response is B. TID stands for tur and die, which means 3 times per day. Question 38, the root word cephal or cephalo refers to, is it A, heart, D, head, C, stomach, or D, liver? Sarah Lynn says B. Chrissy says B. Vivian says B. Alan Queen says B. Chippo says A. Tamiko says B. Sandra says B. And so if you selected B, head, you are correct. So cephalo refers to the head, as in cephalalgia, which stands for headache. I just rather call it a headache because I wouldn't be able to pronounce that other term too often. Question 39. The prefix pre means, is it after, before, between, or outside? The prefix pre, what does it mean? Sandra, Chrissy, Rodalyn, Alan Queen, Valerie, Sheena. So here's the correct response, everybody. Applaud yourself. It is B, before. Pre refers to something that occurs before, as in prenatal or the before birth care. Question 40. The suffix ria refers to, is it flow or discharge, pain, enlargement, or disease? When you see rhea, think of diarrhea. What happens when someone has diarrhea? Yes, Cheapo. Yes, Chrissy. Yes, Buck. Yes, Anna Kay. And yes, Karen. That means they have a flow or a discharge. So the correct response is going to be A. Rhea refers to that normal flow or discharge, as in diarrhea. Question 41, the root word derm or dermo refers to, is it blood, skin, nerve, or bone? Derm or dermo? And we have 9 questions left. You all are doing tremendously well. Again, I hope you're proud of yourself because I'm proud of you. And if you chose B for 41, you know that derm or dermo refers to the skin, as in dermatitis or an inflammation of the skin. This is easy. All right, question 42. What does ICU stand for? Is it intensive coronary unit, immediate care unit, intensive care unit, or internal cardiology unit? Because when you start working in these hospitals, we're going to have all these little acronyms everywhere. We have the MICU, the NICU, the PICU, the ICU. So if someone tells you to go to the ICU, I at least need you to know what you're about to see. So what does ICU stand for? And if you chose C, you are correct. It is the intensive care unit. That's a specialized department in the hospital. Hello, Ismaila. All right, question 43. The prefix post means, is it A, before, B, after, C, during, or D, above? Think of post operative care. The prefix post means, is it A, B, C, or D? And you all are correct. It is B. Post means after, as in post-operative care, which is after surgery. Question 44. What does the suffix seal mean? As in meningeocele. Does it mean tumor, hernia, or swelling, inflammation, or infection? If a patient is diagnosed with a meningeocele, What is wrong with their meninges? Looks like we have our A says B, Chrissy says B, Ann says B, Valerie says A, Nick Bell. So many of you all, so I can't keep up. I'm just going to reveal the answer in 3, 2, and yes, it is B, hernia or swelling. So the suffix "seal" refers to a hernia or swelling. Meningeocele is a condition in which the meninges protrude through the spinal opening, causing a herniation. And when you learn about pediatric illnesses is when you'll hear more about meningioceles. Question 45. The prefix sub means, is it A, above, B, inside, C, below, or D, outside? The prefix sub. Anytime I think of sub, tell you how old I am, right? We used to have the arcade, like the big old arcade games, and I used to love Sub-Zero because he could just freeze everything in Mortal Kombat because he made the temperature below normal. So yeah, that's how I remember Sub-Zero freezing people on the arcade game. But the correct response is C, sub. It refers to below or under, as in subcutaneous, which is under the skin. Question 46. The prefix "an" in the term anemia refers to, is it A, without, B, below, C, normal, or D, above? The "an" in anemia, what does it refer to? All right, I think I see one correct response so far, and that response would have been Vivalin. So it means without. So the prefix "and" means without or lacking, as in anemia, which refers to a condition where there is a lack of healthy blood cells or hemoglobin. And that is common in children and also those with nutritional deficiencies. So if you see "an" or "a" in front of a word, that means they're lacking whatever follows behind that word. The abbreviation QOD, does it mean every day, every other day, every hour, or once a week? QOD. Let's see. All right, looking for some correct responses. Looks like Karen and Panda, Cynthia and Anaya, Valerie. Looks like everyone, Sola, everyone is saying B. Let's see if you are correct. And yes, you are. It is every other day. QOD means whatever that says there in Latin, because I'm not going to butcher that term, but it means every other day. The prefix epi means, is it A, within, B, upon or above, C, below, or D, beside? And now I'll be revealing the answer in 3, 2, and epi means B. It refers to above or upon. So epi, as in epigastric, refers to the area above the abdomen. Above the just above the stomach. So when someone has epigastric pain, it's not that they have stomach pain; they have pain above the stomach. Question 49. Which suffix means blood condition? Is it emia, osis, itis, or pathy? And I see all the right answers. I see so many correct responses. Think of anemia. So if you think of anemia, that means that the suffix emia is the correct response because it refers to blood. So A is the answer. Again, anemia refers to a lack of red blood cell production. Question 50, the root word pulmo or pulmon refers to, is it A, heart, B, liver, C, lungs, or D, stomach? All right, looks like I see some C's, I see A's, I see B's. All right, so I think I see a new person. Her name was Legit. So you all are correct. Pulmo or pulmon is C. It refers to lungs, as in pulmonology. That's the study of the lungs. And then guess what, everybody? I am so proud of you. Give yourself applause. If you can recall how many you missed, how many you got right, please go ahead and post it in the comment area. And then don't forget that tomorrow at 10 a.m., Saturday, bright and early, if you want to learn about EKGs, if you want to do a practice test, of course, with all of my tests, I'm also mixing some teaching because I think that learning should be fun and fast. If someone's boring, I'm going to fall asleep and I won't learn. But you have to go to my other YouTube channel, which is up top. It is youtube.com/Eunice Mathis. That's where we're doing the NCLEX, the nursing prep courses. So this channel, Florida Training Academy, is for CNAs, for CPR, for my business owners, but my nurses and my nursing babies, they're going to get their own channel. That way it won't be so confusing. And when I sign in, people won't be like, hey, asking me questions about phlebotomy when we should be focusing on EKGs and rhythms. All right. And so you all are so welcome. So how can you help me? You can like the video. You can share the video. Of course, you are commenting now. You can also subscribe. And I haven't had any coffee today. So if you want to donate to my coffee fund, you can cash out, or I think on my webpage, I actually have a link that says, hey, buy Nurse Eunice a cup of coffee. You all, it is so appreciative. And I am appreciative of you all. And I wish you all a blessed rest of the day. I'm going to stay on a few minutes just in case you all have any questions. And because we got 10 thumbs up, we got 10 comments, we need to be scheduling our live via Zoom, where you all will have your cameras on, where I can hear your voices. And what do you all want to talk about? What do you want the review to be about? Because if you all are mostly nursing students or CNAs, I don't want to be talking about something that wouldn't benefit you right now. So do you just want to have an open live where we can answer whatever questions, or do you want to have an agenda, such as we review calculations or dosages? Mila says medical emergencies and how to handle them. So if you all agree with Mila, put a 1 beneath the comment or in the comment area. Or if you have another suggestion, go ahead and enter it. Oh, yes, it is Michelle. It is, I'm going to go back a screen so you can see. It's at the very top. It's youtube.com/Eunice Mathis. And I will also put it in the chat. All right, so Panda says safety and infection. I'm gonna write this down because, by the end of the day, I'll have to add more things. So I think we can do both. We can do medical emergencies and safety and infection. You're so welcome, Serafina. So now here's the next question. Do you want this live to be held in the morning or in the evening? Oh, Sheila says vital signs. Oh, all right. We'll just plan on being on for an hour. Let's see. We have food. And let me finish writing this in. All right. Mila says she wants the review held in the morning. Let's see. Desiree, I did a video on home health last week. So when you say home health nursing, can you be more specific? Are you wanting to know about the skills that you'll be performing in the home, or, is it just something general? So if you can rephrase that and make it more specific, I'll know how to best help you. Hi, Jing from the Philippines. All right, so looks like Chrissy says morning. So we will hold this in the morning. I saw that when I liked it. All right, so what we'll do is we'll hold it in the morning, and I will try to shoot for next Saturday morning, but I'll make sure that I post it. It'll be posted in our community area on both of our YouTube channels. So we will be doing a live. I'll post the Zoom link, and then you all can click on the Zoom link, enter the code. Only the people with the code will be able to come in, because sometimes I get people who are not always there for the right purposes, and we don't want any distractions. So everybody, we have been on for so Michelle says evening is better. She works at a doctor's office. We'll do too. We're here to serve. So we'll figure it out. I'll have a Zoom link for the morning and then a Zoom link for the evening. And then what I'll do also is I'll break some of those topics up. So if you want to attend one session, you can. And if you want to attend the second one, you can also. I hope that works for everybody. That's right, Serafina. Yes, we should. So we have days and evenings. All right, you all. It is Friday. I'm out of here. Remember, if you all want to join our EKG review on tomorrow, it's on my other channel. You all be blessed, and I'll see you in the next video. Bye.